Hello, I'm Mary Burguieres. I'm Lead Manager for Policy and Strategic Partnerships at Surrey County Council. Surrey was really privileged to establish a relationship with the centre very early on in its creation, and it's been I hope, a mutually beneficial relationship. But certainly, we were very keen to have the centre work with us in the development stage of the mental health crisis program, and so the centre became an integral partner, actually, in our multi-agency partnership from almost its inception. And we drew upon the insights that the centre had in terms of signposting us very quickly to some of the issues, some of the challenges that we were likely to face around information sharing. So it was at the forefront of our local leaders' minds from the beginning that information sharing was something that we were going to need to build into our program from the beginning, do it quite consciously, and recognize that it wasn't going to be easy. So to begin to look for the places where we would need to share information, who held the information, and what information we actually needed in order to deliver, let's say, for instance, a safe haven. The centre was, I would say, a trusted advisor from the beginning. And I remember colleagues from the centre joining us very early days and leading us through a workshop with some case studies about how people might come into contact with our services now and what would need to change in order to deliver the outcomes that we wanted. So some very early helpful developmental thinking when we were in that kind of discovery stage. Subsequently, the centre did a much more considered piece of work for us, really quite deep research piece of work that analysed where our information gaps were. So a really thorough kind of gap analysis, but also asset analysis, where we had information, where we didn't, where the flows were happening well, where there was clear leadership, and maybe where there wasn't. So did a very good picture for us of the as is, and in that gave us some recommendations in terms of the to be, and we built those into our work program. So within 6 months, we had built that into our work program, with the multi-agency steering board able to address some actions towards each of those. And I think that early help from the centre, both in terms of advice, but also kind of analysis, a picture playing back to us, where we were, was incredibly helpful foundation for us. I guess since then, we've maintained that contact through the centre with help in terms of, showing some of the challenges we're facing, advice, connections to other places that might have cracked it, or, working like us hard to try and crack it, so you could share some of that learning. They also, in fact, just yesterday, we hosted a national workshop that the centre was leading with central government and other places, looking at information sharing challenges and opportunities around mental health. So again, I really I feel like I've watched the centre, get its feet on the ground and sort of spread its wings, and I'm really pleased that we've been able to be on that journey with you.